Good afternoon to you all. Uh, Today I was given the task to discuss about diabetes care pathway models for developing countries. Before starting, I would like to say I'm not an expert in this field, so I would like to take you through what is care pathway model and how to make a care pathway model for developing countries within the next 10 to 15 minutes. So what actually is a care pathway? It is a structured multidisciplinary care plan for a disease or a condition. So how do we make it? We have now a lot of evidence-based medicine. And we put together all this evidence-based medicine to make guidelines. And when we put multidisciplinary input to this evidence-based medicine, guidelines, and we incorporate everything into local structure, so we form care pathways. So what is this evidence-based medicine? It's the best evidence we get from anywhere through clinical expertise and patient preference. From where do we get evidence? We get from journals, books, and conferences, and the type of evidence could vary from research, primary research, systematic review, and meta-analysis. So how much knowledge we have and how much evidence-based medicine we have, there's always a gap between our knowledge and practice. So care pathways is a bridge to this knowledge and practice gap. So in a methodical way, so what is a care pathway? It's a structured multidisciplinary care plan, and it's meant for a specific health condition. And there is translation of guidelines and evidence into local structures. And unlike guidelines, these detail the sequencing steps in the course of patient care. And most importantly, it builds in timing of the steps. So when we set up a care pathway, unlike the guidelines, just pointing out what should we do, this should be in timing. In care pathways, we always give a timeline. This should be done within this time. If this is emergency, this should be referred within 1 hour or within 24 hours. So there should be in timing in the steps. So what does it finally do? It standardizes the care in a specific population. So we have a lot of guidelines available locally and internationally. So are we practicing these actually? When a patient comes to our practice, so these are very comprehensive documents, a lot of evidence from international and local data. But when you are practicing, we might not utilize these. There's a huge gap what is in the guidelines and what we do. If one patient comes to me with a fasting blood sugar of 200, what do I do might differ from if she go to some other physician or an endocrinologist. There's no uniformity. There should be a personalized care, but at least there should be standardized care among our treatments. So a care pathway would look like that. So this is an example I have took from the Sheffield Food Care Pathway where I worked. So it's a structured care plan. It's easy to follow. It's for a special health condition. For this is for a food care pathway for people with diabetes. All are defined, and it details steps in patient care. And it incorporates latest evidence-based medicine into local structures, and there is timing. So if there's emergency, there should be a timeline. If this is not an emergency, again, there should be a timeline. The patient should be seen or referred to eye surgeon, say within 1 month of diagnosis, within 1 year of diagnosis. So there should be a way of timing each and every step in a care pathway. So why do we need care pathways for diabetes? We had a lot of talks before that. Dr. Reddy, a lot of information on Asian data. So diabetes is a highly prevalent disease in South Asia. There's multi-system involvement, high mortality and morbidity, and loss of productive life years due to complications. So we have several guidelines set by multiple colleges, but we lack standardized care in diabetes. So if you look at the IDF Atlas, this is 2021, I think, so it gives diabetes hit the poorest hardest. It's the homepage. And 3 in 4 people with diabetes live in low and middle income countries. So we are in that group. And there's a high prevalence of diabetes in Southeast Asia. So we are the people who will get best benefits of care pathways. So since this standardized clinical care, and since there's uniformity, they will cut down the costs, and it will optimize resources and minimize variation in clinical care. Improve coordination of care across the teams, because this is a multidisciplinary team input, and improve structure and predictability of care, and help to evaluate quality of care and make improvements. So if we are to have care pathways, we need actually to have good electronic monitoring system. Then only we can have inputs back, and then we can improve our system. So care pathways for diabetes, we could have any care pathways. We can discuss among our colleges, primary care, secondary care, tertiary care, and preventive medicine, NCD, and we can make care pathways for anything. Care pathways could be for screening for diabetes, or could be for diagnosis, could be for oral care, for glucose lowering therapy, care pathway for food cares, and care pathways for diabetic emergency. So we can get together and make care pathways could be uniform to all. There should be multidisciplinary team involvement. So from primary care medical officer to specialist, endocrinologist, physician, nephrologist, neurologist, eye surgeon, nutritionist, and primary care health specialist, and family medicine specialist, and everybody should get together, all the specialists. Not only the doctors, most important thing is we should get involved the other health staff as well, the nurses, diabetic nurses, healthcare assistants, podiatrists, and pharmacists as well. So now we look, how do we set up a care pathway? It's a 7-step process. First, you identify the population, and then you need to assign a group of people to do that. Then you need to look at the research and map out how to do, and then develop, and you have to do a pilot testing on that, and then implement. So if we go through each of these, so we should identify the patient population. Most would benefit if the patient population has high volume admissions, as in the case of diabetes. It has multi-system involvement and multiple complications, so there is multiple high volume hospital admissions. And severe conditions requiring more resources, requiring multidisciplinary approach, and big variation in care. So diabetes has everything of these, so diabetes is the best thing to start the care pathways in the low resource setup. And then we need to assign a group. We need to assign interdisciplinary quality improvement team representing all the multidisciplinary team members. And they should be responsible for formulating and starting care pathways. Then they should look at the research, evidence-based practice approaches. They should review local and international guidelines, review similar care pathways in other centers, build in time frames, and treat to target plans. And then they should map. So you have to look at the current state of services in the local setup and the referral pathways, map all aspects of current patient flow, involve all this involved in provision of care, all the categories, and look at variation in care, time taken, and the resources used. And then only you can then develop the system. So you identify steps that could be incorporated, gain consensus among stakeholders, and establish outcome measures and indicators to assess the progress. And we should also determine the frequency of data reporting at this stage. And then you can do a test the care pathway in a pilot study, and get feedback from the team, and make necessary changes. And then finally, you can implement the care pathway. So we have a new care pathway, but it requires commitment of all the staff involved, because it's a lengthy process, it's a time-taking process, and it requires a lot of evidence-based medicine as well. And we should be able to make a success based on the predetermined outcome measures. So what are the challenges as developing countries for this? Most common challenge would be resistance to change. We know Sri Lankans are known for resistance of change. So from healthcare providers to other stakeholders, there is resistance to change. And lack of understanding of the benefits of care pathways is still there. And we have inadequate data structure and information technology, because for us to have a successful care pathway and to see the progress it makes, it's good if you can have data management systems and online digital systems, which are lacking. And most importantly, lack of funding. So how do we overcome the challenge? So we can engage with key stakeholders, including all the healthcare providers at all stages, and policymakers and health ministry and all the administration. We can get together and face this challenge. And we can do training and education programs. It will be on healthcare workers and care pathways. So that will not be a difficult task, because all the colleges are involved in that training and education program. We can incorporate this into their pathways. And the most important thing is a way to find investment in IT and data management systems. So let's make a change and try to incorporate care pathways into our system. Thank you.